Hi, I'm Sarah, and amongst other things I'm a biochemist. So today's video is about why I have a problem with certain vegetables. So I'm not against vegans or vegetarians or anything like that at all. I just have a thing against oxalates, which is a particular compound that's found in leafy vegetables like spinach, chard and kale. And the problem with oxalates is they're the things which build up kidney stones in your body. So if you've ever had a kidney stone, it's very horrible and unpleasant. I've never had one personally, but I've seen the aftermath of other ones. The problem with oxalate crystals is they build up in all kinds of other tissues in the body, so they can create joint pain, thyroid problems, and also for a lot of women, pelvic pain and things which look like a UTI but aren't. So I learnt my lesson with the oxalates when I was staying with my aunt and uncle, because they grow lots of leafy vegetables in the garden and I was too polite to not have them. And then I did come down with some pelvic pain and I did think it was some kind of urinary infection. So I'm not saying don't eat vegetables, I'm just saying if you're prone to arthritis, pain, UTIs, pelvic pain, kidney stones, thyroid issues, I would strongly consider removing leafy green vegetables, particularly when they're raw, from your diet. There are ways around the oxalates, and there's a lot more that I could talk about. If you're interested in it, then look up Sally Norton on the internet. And just to clarify, I'm not saying anything against vegans or vegetarians, so please don't write a load of hate, because all I'm doing is trying to help people. And women are tormented quite a lot by this pelvic pain and UTI, so even if you like eating leafy vegetables and don't have a problem, there's probably somebody out there that does. So thank you very much for listening and watching, and have a great day.